slow death.
I think of a dreaded disease.
Illness and tragedy.
I'll say homosexual. Innocent babies.
HIV, disease.
At one time we used to make light of it, but no longer.
Confusion and misunderstanding.
Something that has been blown out of proportion is kind of scary to look at.
AIDS, a serious question that needs to be looked into.
What I fear most would be getting it from them.
With a new disease such as AIDS, you don't know how to approach a person, who is affected.
So I think it is much more transmissible than the medical community is willing to tell us.
I feel death when we're talking about our AIDS.
AIDS does not discriminate, it does not care.
I said, bingo, my friend. You have this disease. Yeah, I knew I was at risk, number one, because of my lifestyle. I was a firefighter working in the ghetto. A lot of times we went into shooting galleries and stuff like that. A lot of times you get cut. Then I used drugs, and I like to party. So, really, that within itself, I wasn't smart. But I didn't think about it. It can't happen to me. It'll happen to you, but it won't happen to me.
I think my first experience of dealing with AIDS is when I found out I was HIV positive. And over the last 3.5 years of dealing with that, the Association of Flight Attendants has allowed me the opportunity to continue to work by making sure that the company follow the guidelines that they set up to allow me to work. But also, they've allowed me to help them educate the membership about the fears that are out there among everybody.
I first started to realize that the AIDS issue needed to be addressed when our membership was affected so greatly by it. So since then, we've incorporated a lot of training and a lot of support groups and resources to try to help our membership to deal with the fears, to deal with HIV themselves and their family members.
I get calls from people who have just been diagnosed HIV positive quite frequently. And their first concerns at that point in their state of shock is how to afford the expense and how to keep their jobs. So they will call me before they've even dealt with the emotions or their family.
AIDS has affected someone now who's an officer in our local. He's someone who's done a tremendous amount of work and has been very devoted and dedicated to our union. It has forced us to really take a look at the issue from the proper perspective, and I think everyone in our local now has a different outlook on the AIDS issue because it's affected someone who's near and dear to us.
This lady gets up towards the end and she says she had just nursed her son who had just died with AIDS. That was when we had classes on AIDS, and it was just like, it just made it real. It just brought reality home, and that just made you kind of think, look, we got to get out and we have to do something about this.
Listen, I don't want to happen to the rest of the local presidents like what happened to me. I went out to a member's funeral, and I found out at the funeral that he died of AIDS. I went to the mother and brought him a Bible, and that like we normally do. And she reached out for the Bible, and she said to me, she said, gee, the Bible's nice, but he really needed you when he was alive, and he didn't know he could come to you. He didn't know that he wouldn't be discriminated against, that he was scared to death. And I want our local presidents to know that we can be a safe haven, that just like any other issue, that we're there for them.
There's a few things I think are really important for us to understand about the virus in terms of understanding what really is cause for concern at the workplace and where isn't there.
I went to an AIDS conference, and I was able to sit down with someone who had AIDS and learn from them how they took care of other people with AIDS. And I think any prejudices were eliminated at that time.
After going to the AIDS training workshop, it did relieve the fears, and I do feel that I would have been able to work with them easier, and I do feel that I am working at a pace that I'm not afraid.
And we have the green package wrapped by James.
The union should fight for having AIDS education Because if the union does not protect its members, there won't be any members. And we wouldn't have a job. And in our contract, there are conditions set up for safety, you know, in the workplace. And to me, this is definitely a safety issue.
AIDS education is very important because it teaches you how not to get infected and how to protect yourself so you don't get infected.
You okay? Done now?
I've been a healthcare worker for 20 years, and it's been a lot of stress to try to remind myself that I may be at risk from taking somebody's blood, something that I've been doing for 20 years, to say, well, one false move and I may be infected with the AIDS virus.
It's the biggest problem that healthcare workers face as far as transmission of bloodborne infectious diseases is trying to reduce the number of needle stick injuries that people get. It's somewhere like 1 million needle stick injuries a year in this country. But people don't usually talk about that in the way they would talk about other occupational health and safety issues.
But cleaning up the debris around the patient, there was a needle and a paper towel, and I balled the paper towel up and the needle went, punctured my hand. So I immediately reported it, took the proper precaution of washing and cleaning, went down to employee health, and had my labs, had blood drawn. So basically what I have to look forward to, if whatever he has is positive hepatitis, AIDS, I'm not very pleased because it depends on what his lab work showed, and then everything depends on that. And if he comes up with something positive, I don't think I'm going to need a lot of support from everybody, especially my union.
At one point, we had a large number of needle sticks, and it was just driving our housekeeping staff crazy because it was like no one was conscious of the fact that they could not just take open needles and just throw them in the trash along with everything else, especially working on one of our highly infectious units. So we had to do an intense in-service, and we had to bring in other products that would assist some of the nursing staff and kind of teach them that they should be more conscious of needles, especially in our emergency area also. We have like contaminated boxes now that's at each bedside of the patient, and the nurse is instructed that he or she is to place those contaminated needles right in that box. And they're not even supposed to put the rubber stoppers back on the needles themselves, just dispose of the whole thing. So as a result of that, working through the safety committee and all unions working together, we were able to get the whole issue resolved. And so now everyone feels very safe.
And yes, needles should be properly disposed of, but not every needle makes it into the dispenser.
A nurse that works on a unit that has many patients with the HIV infection as well as full-blown AIDS, she sustained a needle stick. One thing, though, that she was very surprised at, and that I guess I never prepared her for or even thought of, was the reaction from her coworkers. She, approximately a week after that incident where she had the needle stick, she brought a cake in and for people to eat on the floor. And another coworker said to her, "Do you really think you should be bringing food in?" And that was a direct response to the fact that she had had a needle stick from an AIDS patient.
There's a lack of education amongst people, and they have a misconception of how they contract AIDS.
You don't get AIDS by sneezing, or you don't get AIDS by just sitting on a toilet, or you don't get AIDS by just talking to someone that has AIDS.
What are other ways? Needle sticks? Any other ways that the AIDS virus is spread?
Bites.
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 What about bites? We got some no's and we got some yeses.
But when you talk about education and training, you have to talk about changing attitudes first, because understanding HIV disease is not that hard, but people dealing with their fears and their phobias is the most difficult thing.
We're not afraid of the patient with AIDS. We use universal precautions. We are trained to work with AIDS patients. No, we're not afraid now.
AIDS is affecting almost everything that's going on in the society. A good example of that is how it's transforming the healthcare system.
The trend today is to cut back on employers' benefit, health benefit. It's a real problem when you consider that AZT is costing $800 to $1,000 a month, and most people with AIDS need to be on AZT. So if an employer drops the prescription plan benefit, you have significantly impacted on that person's financial security. That this is not a moral judgment. This is a health crisis, and it has resulted in rampant discrimination and prejudice against people, and it's no different than discrimination against women and discrimination against minorities and discrimination against sexual minorities, and these are all issues that the union has been in the forefront.
And I think that AIDS and the issue of the gay community, those are all discrimination issues and how the AIDS victims are being treated. And we cannot pretend because this may be more controversial than race, national origin, or religion. We cannot pretend like it doesn't exist and not put it on our agenda.
Well, the easiest thing to me to prevent the virus is it's education. We have to educate our members, not just the members, the community. We have to get the word out. You've got to arm them with resources in the community, and they can network with the community, whatever the local AIDS agency is, Red Cross. There's numerous agencies out there.
And I feel that the people need to be educated. I really do. And since the shops carry a large group of people at one time, that's the best place to start.
Everyone, children, we all have to know about this. And we have to know it's not going to kill us to hug an AIDS victim. We're not going to catch the disease if we use the same glass. We just need information.
What I try to do is remove that fear by educating.
The only solution that I see is education.
Oh my God, I couldn't stress that enough, that AIDS can be prevented.
I believe we can conquer our fears, standing strong, like through all these years, protecting rights is what our goal should be. AIDS strikes indiscriminately.
If a brother or a sister needs us, 'cause their back is up against the wall,
We can't let a disease defeat us. We must always hear their call, 'cause we believe in solidarity. We believe in solidarity.
Great pride being a union person and seeing the union dedicate so much time to the caring of people.
You can't understand what they're going through, so what you can do is be there for them.
I think with information, it would stop the discrimination that comes with it.
Y no tenemos miedo.
The reason why I've lived as long as I have with this is because the environment that AFA has helped to create has been beneficial to me.
All of our unions have members who are affected by this disease, and we cannot stand by and wait